On to our next panel, and for this, we will be digging a little deeper, exploring ESG's role in longevity. With the power of genetics, epigenetics and prevention, mental health as a pillar of aging well, and the strategies that organizations can adopt to drive change. So, for this, I would like to introduce Maria Antonela Axinte, and I hope I got that right. Maria was just there.
Ciao bella, Antonella. There you go.
Joe, where did Maria? She was right next to me. Okay, so I think somebody may have decided to speak to Maria on the sidelines just now. Okay. Just 1 second. Arab Health, right? Okay, so whilst Maria joins us, actually, Marwan, can I introduce you to join back the panel? I know you're a very busy man, and I know you have, again, 1,000,001 meetings. I don't know how you guys do it, genuinely. But can you just tell me a bit more about what's coming up with the DSP Leadership Network? What are you excited? I know hiking is coming up, but I know you've had a lot of feedback so far as to what professionals want from this business network. What has been the feedback that you've received? Because I don't know all of it yet.
Yes, the feedback has been great so far, and we're still getting more and more. So, the more ideas you have, the better. That's Dr. Maria. Please come.
We lost you.
That people want to have, please have a seat. People want to have subgroups. So a group, to, let's say, talk about policies, a group for startups.
Yeah.
So I think, that's one of the things that we will conclude, not yet. We're still, gathering information. And we will create these specialist groups, bringing people together. Because, a database of 2,000 people, it has to be broken down and very focused.
Yeah, of course.
To achieve better results, obviously.
Of course. And look, the one thing post that first launch, the soft launch of the network, and where we're explaining, similar to this presentation, what it was all about, what I noticed, everybody, you mentioned meaningful connections, and since then everybody's been talking to me about that and saying, oh, we really need meaningful connections. It's not just about me coming to you and going, hey, I need this, give me all of this. No, it's about how I can help you, you can help me, how can we work together, and ultimately it's about benefiting the healthcare, life sciences, and broader sciences ecosystem within the United Arab Emirates, right?
Yes. Hashtag meaningful connection.
Hashtag meaningful connection. Speaking of hashtags, if you want to find us, please use the hashtag DSP Leadership Network. And obviously, for all information about this network and more, please follow Dubai Science Park at Dubai Science Park via social media. So Marwan, I know you're busy, but may you please join us for this one as well, because I would like your insights. So in case you didn't know already, that's Marwan Abdulaziz Janahi, who's the Senior Vice President of Dubai Science Park, Dubai Knowledge Park, and Dubai Academic City. Thank you so much for being here, and beautiful booth, by the way. And reintroducing the lovely Maria Antonela Axinte, founder and certified genetic counselor for DNA longevity. I hope I got it right. Thank you so much.
Thank you for having me.
Thank you for being here. And I'd like to introduce as well Sarah Hariz, Policy and Government Affairs Lead at Organon. Welcome, Sarah. And last but not least, Dr. Tina Mistry, a GCC-based expert in mental health strategy and innovation. Should I move him? I think you need to go to the back of the class. Yeah. So, Dr. Tina, welcome. Right. Ooh. I like this. 4 ladies against 1. Yes. Okay, so I'm loving this panel already. No, guys, it's a pleasure. It's a pleasure to have you here. And as we've seen, we've had a really, really, really informative first panel, especially relating to the government's involvement in longevity and precision medicine and all of that. We could have just really listened to them kind of throughout. But here we're going to kind of break it down a little bit more and talk about the connection of ESG to longevity, the mental health connection as well. I think looking forward, I mean, in media as well, when we're talking about longevity, one of the things that are somewhat lacking, correct me if I'm wrong, but the impression that we get that a lot of businesses and workplaces are not really prepared to fit in with the longevity strategy of the UAE or the GCC or globally, right? So, as we know, ESG, maybe, I don't know, 10 years ago, people didn't really know what it was, right? But now the principles of environmental, social, and governance frameworks are reshaping industries, and healthcare is part of it. But how does ESG actually align with healthy longevity? So Sarah, I'm going to start with you. I think this mic is working, hopefully.
Hopefully.
To you, how do ESG principles prioritize stakeholder well-being, whether through employees, patients, or communities?
Hopefully you can hear me, and thanks Rachel for having me, and to Dubai Science Park as well for hosting. I think the principles and ESG frameworks are essential for organizations as they ultimately provide the structure and the inspiration to set up programs that can really impact longevity, healthy living, healthy lifespan, whether that's looking internally at organizations, employee well-being programs, or externally through like the ripple effect of some of these initiatives that may look to reduce, let's say, carbon emissions that ultimately end up impacting the health of communities as well. When we think about it in terms of Organon's perspective, so I work for a women's health company, and we ultimately look at delivering ESG initiatives under the UN Sustainable Development Goals. So, for example, UN SDG Goal 3 for health and well-being, or UN SDG Goal 5 for gender equality. And so we use that framework of ESG to guide where we focus, also guided by the UN Sustainable Development Goals, so that all of our initiatives and our resources are directed towards, let's say, initiatives that help address women's health unmet needs. And that can be things like fertility, women's health, maternal health, reproductive health. So we use that high-level framework to then guide where we direct our resources. And staying with that sort of intersection of healthcare and ESG, there's a real social purpose to that, like focusing on healthcare. And using ESG to focus on healthcare, it's focusing on removing any health disparities, ensuring there's equitable access to healthcare services, solutions, and treatments. And when we look at that with the women's health lens, I'm not sure if you're aware, or there was a recent publication from the World Economic Forum and the McKinsey Health Institute, which identified that there still are disparities for women and men in healthcare, and that women often spend 25% more of their time in poor health. But what's interesting is they actually identified the 9 conditions that are impacting women in that space, and there's 5 that are limiting lifespan and 4 that are limiting health span. So if we then look at it with that lens and we focus our investments on those conditions, we're able to really make an impact to longevity and the health span of women and broader communities.
That's so interesting how, the data that you're mentioning as well. And funny enough, I know this is kind of slightly off topic, but when you mentioned that, I also remembered the stat about health insurance and how women pay more for health insurance.
Yep.
And when you ask a health insurer, they're like, well, it's because of maternity. But it's an actual fact. It's because women are more likely to go and seek answers for their health. And so it becomes more expensive. But then they use the whole, but it's menopause later. Because when you say, my maternity, Anyway, I could rant about this all day. But
are you saying that men have stigma to go to the doctor and talk about their issues?
Doesn't it take a lot? Yeah. Actually, a recent wasn't Advanced Health. You had a session on mental health, and you actually shared an anecdote about how to convince any male member, senior member of the family, to go to the doctor took a lot of convincing, potentially bribing, right?
Almost.
Yeah, you wait until it's too late. Well, Marwan, okay, so talking of longevity and healthy systems. Look, how can ecosystems like Dubai Science Park actually drive sustainable healthcare models? Because you advise a lot of startups. You welcome startups from around the world. You support locally homegrown startups as well. When you talk to them about their ESG practices, I know obviously we don't have a local framework, I suppose. I don't think there's a standardized local framework throughout the UAE. Again, correct me if I'm wrong. But I mean, what would you advise them in terms of their ESG commitments right now? What should they be implementing from right now?
So I think, I mean, there is ESG in healthcare is a very, very big topic. And there is a lot of data out there that a lot of the hospitals and the pharmaceutical companies omit, lots of bad things to the environment. So the question is, how do we reduce the number of visits to the hospital? And that happens through prevention, right? So what are the measures that we should take to use digital health, to do telemedicine, for example, teleprescriptions, many things, to not reach to that level where we need an operation or we need to seek medical health, medical support. And there is a lot happening in the startup world when it comes to digital health. So we have in our incubator around 40 companies, mostly in the digital health space. And they're doing so many things, to learn more about ourselves through a DNA test, for example, to facilitate appointments, telemedicine, and many other initiatives to basically connect the patient to the doctor.
Well, it's interesting that you've spoken about DNA, and speaking of DNA and DNA longevity, which I believe is part of Dubai Science Park. Now, Maria, we're shifting from panel one, where it's policy, to precision health, and now looking at genetics and epigenetics, for example, and how they're transforming preventative strategies. So, Maria, as an expert, can you break down the fundamentals of genetic counseling? Just what is it, and how does it help identify hereditary risks and guides those proactive health decisions, maybe in the workplace?
Sure. Thank you, Rachel, for the question and for having me here. Mr. Marwan and Science Park, thank you for having us. Just to give a little bit of background, DNA Longevity is a startup, part of Science Park, a little bit below 1 year now. So we're trying our best effort right there to literally bridge the gap between clinical scientists and patients. That's what genetic counselors do, but I'll break it down even further. So we are trained in human genetics and psychology, and we are explaining, translating, and exploring health risk, genetic health risk, which are occurring either in the individual or family members of that individual. And we're helping them with navigating management and prevention methods. So genetics is inheritance. This is how everybody knows, but it's also non-inherited as well. So we have to break down the concept of inheritance versus non-inheritance. We call it Mendelian inheritance. That's when we have certain gene passed from one generation to another. A genetic counselor will evaluate, assess family history, taking 3 generations of, we call it pedigree, and that is going to be a clear indicative whether there is a genetic condition potentially to be passed on to future generations. After this, there's going to be a genetic test. If that is concludent results, there will be a recommendation, whether is to one of the other professionals, other disciplines, to undergo certain treatments. Preventative early intervention is prevention, right? Yeah. Or perhaps lifestyle changes in some of the cases. So I would say genetic counselors are the key to unlocking the book of genomic makeup of an individual.
100%. And you were mentioning lifestyle. I believe epigenetics is somewhat again, not an expert, but it's what what you experts tell me about and what I read about and whatnot. It is redefining aging science. So I'm curious to know how lifestyle, diet, and environmental factors can switch genes on and off and influence, our health span. How can I switch off my bad genes? What do I need to do right now? Yeah.
Great, that's a good question. I'm sure everybody in the audience would love to know that. So epigenetic as a terminology, it means beyond genetics, so above genetics. We're not looking at the sequence of the gene that is passed on from our parents, from mother, father, but we're looking at the transformation or changes within the protein that is resulting from a gene, without changing the sequence of that particular gene. And how is this process happening? There are several processes. So epigenetic changes can be caused by methylation, for instance. That changes the quality of the protein or interrupts the protein that is produced. It could be histone modification. Histone, it's a organism that it's actually helping the gene to be wrapped around. So the epigenetic modification means that is going to be tighter or more loose around the histone, and therefore the protein resulting will be altered again. Non-coding RNA, for instance, that's another way of epigenetic modification. So none of this situation happens that the DNA is altered as in the sequence. However, you see the protein quality or the disruption of that protein is caused. Now, to your question, which is a very much of a, lifestyle changes. So when... That's it. That's the bottom line. So I'm going to break down to one case scenario. For instance, a patient that is, and we all, by the way, we are carriers of 3 to 4 genetic variants, which alone does not make us have the disease. However, when coupled with the same variant from the partner, that gives 25% in each child to develop that disease. So with that in mind, we're thinking, right, so if I'm a carrier, I'm cool, right? Like I have no problem. Well, that's not exactly it. So recent development says that recessive genes, although do not give that particular disease, however, do increase the predisposition for organ disease development. Means you will not have liver disease, for instance, but then you will have that spectrum of conditions that you're exposed to. In which way? Lifestyle. So lack of sleep, stress, bad food, non-exercising. Stress is probably the biggest factor of epigenetic change, and we currently develop technology in together with laboratories in Switzerland, where we're trying to detect the epigenetic changes that indicates the highest level of risk of stress. Because if stress is high, it breaks down into so many components to alter your protein production. So, like I said, lifestyle changes. What are the lifestyle changes? Nutrition, physical activity, relaxation. So all of these factors do reflect. Even the air we breathe, it influences our epigenomic makeup.
100%. Now, given how busy Marwan has been the past 3 days, I feel all of the good lifestyle factors that you've mentioned. It's like sleep, nah. I feel that nod is very telling. Like, I tell you, Marwan, how much sleep have you had the past few days? You've been very, very busy, obviously supporting startups like Maria's DNA Longevity. But I'm just curious to know. I don't know the story with DSP. Do you actually look at what they can bring to DSP? Do you look at what they're bringing? What attracts you to these kind of startups? What do you look for in a startup?
I mean, as long as they're doing something completely new and it's supporting the entire ecosystem, then they're definitely welcomed.
Yeah.
So, and when I met with Dr. Maria and Joe, you know,
Hey Joe.
they had a compelling story, right? And that we thought that what they do is something that supports the entire ecosystem, whether it's clinics, hospitals, individuals. So why not?
Yeah, why not indeed? Now, talking of stress and other things such as anxiety and depression, etc., etc. Now, Dr. Tina, you're a mental health expert and you work in the GCC. Let's take it a little bit more and explore the mind-body connection. Now, we know that chronic stress, depression, anxiety, et al. Accelerate biological aging. So why is early intervention so critical? Because sometimes we feel, it's just impacting us right now. But essentially, considering as somebody in media, the amount of stress I'm under, I'm probably like 70 inside, like my biological age is probably 70. So what do I need to be doing now to kind of manage that? But also as a workplace, what can I be doing to ensure that we're also following following ESG in a better way, so to speak? Sometimes, corporates especially, they throw ESG to you and you're like, where do I start? Especially as smaller businesses. Where do we start?
Big question.
I know.
Thank you. So thank you for the opportunity. As a psychologist, this is something that is obviously so close to my heart. I have been working in the field of mental health for the past, dare I say it, 15 years. And it's a long time coming that this conversation now has become mainstream. So I'm so grateful that we're finally being able to talk about psychology, mental health, well-being, the whole aspect of being a human, and actually the struggles that we face as day to day, because there is still so much stigma and shame around mental health. But these kind of forums are exactly what we need to be doing, is bringing it into the mainstream conversation, sat alongside the conversations around physical health and life sciences. We're no longer a nice to have, it is an integral part of what we're trying to be doing here, which is human-centric well-being. Human-centric, longevity, that's the whole point of this. Now, mental health is a hugely abstract and very vague concept that I think that a lot of people struggle with. What does it? When you conjure up the idea of mental health in people's minds, you think of somebody who is really unwell. But actually, it's the spectrum. It's the whole piece of when am I flourishing, my best self, to the point where I'm not myself, where I am actually really sick and I'm struggling to get out of bed. It's the whole spectrum when we all have mental health. And that's the bit that I really want to remind people, that it's not just a one point in time, it's every single day, it's every single moment, it's every single element and our connections to each other that is part of our core of our mental health. Now going back to your question, that we've all got a responsibility when it comes to mental health. And it is, like I said, it's the biology, the psychology, and the social. So we talk about this framework whenever we're thinking about mental health, is that it doesn't sit in isolation. And as organizations and workplaces, we have a responsibility to care. You talked about duty of care. We all have a duty of care as being members of society. So organizations need to be thinking about this from a sustainability angle, the social part of the ESG. That how are we keeping our workforce healthy and well, and keeping them in a place where they feel like they belong. And touching on the longevity aspect, that ultimately we're talking about loneliness as an epidemic. We're saying that it's equivalent to smoking, I think 50 cigarettes a day or something like that. I don't know what the stats are exactly, but all of us are feeling lonely. But actually, how many of us are taking the next step to be looking after each other? And I say this in a very simple way, but it's small things that we could be doing. And it's not big science, rocket science, computer science things. It's looking into each other's eyes, being kind, being courteous, opening the door, asking how are you? It's small things that can make a huge, profound difference to each other's mental health. So I'm not sure if I've answered that in a very direct way, but we all have a responsibility, and it's all about us taking ownership. But it does start from the top, I agree.
Yeah, definitely. Funnily enough, actually, I was emceeing Empower, which is a Women in Healthcare conference yesterday, and one of the leaders, very well-known leaders, she was talking about how when she went into the workplace, and it was quite a tough workplace, and one of the first changes she did was making sure that everybody, if they were about to email, that they have to email Monday morning and not leave it till Friday at 8. And that made the world of difference within 6 months, and people were really thanking her for that. I heard also another strategy where you put underneath your signature if you're in different time zones, just to say, look, this is just my time, it suits me, you don't have to reply straight away. It's just those little things make such a difference. Now, Marwan mentioned earlier about digital programs, digital solutions. Look, whether we like it or not, AI is here, technology is here. Dr. Ramadan's a great promoter of AI. But are there any digital mental health solutions right now, or community kind of based technological programs that can bring us together? We're doing our part with the DSP Leadership Network, getting people together, because we did recognize that sometimes entrepreneurship, or just constantly being, grinding, it makes the world of difference meeting people. And I see so many familiar faces, and we just connect. We don't just talk business, that's it. We just talk, hey, how's it going? So in terms of digital solutions, anything standing out to you right now, or is it still very much personal?
Yeah, so mental health, again, being very broad, it's very, very difficult to find a tool that's going to fit everything and have a solution for everything. So again, if we're thinking across the spectrum, what are we targeting when it comes to mental health? What actual piece are you trying to solve for? Now, technology, as we've discussed earlier in the earlier panel, is an enabler. And I'm excited because people are starting to now piece together the struggles and the key data points. And this is the bit that I'm excited about with AI, is that it's enabling complex information to work into algorithms and patterns and all the techie stuff that I don't understand. But as a psychologist, I've always saw things from complex patterns and systems, and how do we piece that all together? That's where I'm seeing the technology and innovation and the excitement of us coming together as thinkers, as innovators, as people who want to solve these complex challenges and use this technology to then hopefully try and create some logic and some ideas and inspiration to bring these very difficult, broad challenges into the reality of what we're experiencing in day-to-day life. I'm not saying it's going to be a quick fix. I'm not saying it's going to be a solution for everybody, but also bringing into the aspect of gender, culture, language, bringing in old school, authentic ways of connection. So we talked about spirituality and religion. All of this actually has a lot of data and value. We need to bring it all together in a meaningful way.
Spirituality is such a valid one as well, because there was another panel I was seeing as well, and they were talking about prayer, for example, in Islam, the 5 prayers a day, just that moment to, and lose.
But what does that do? It makes us mindful. Reminds us of being back in the moment, connecting to our bodies. This is stuff that you already know. This is not new science. We're getting the science now in terms of how it shows with data and our biomarkers, etc. But this stuff we've been doing and practicing for years, and we've got to just bring this all together. And I think that this is a collective effort that is a very, very exciting time.
Now, Sarah, businesses obviously get a bad rep, right, for not really taking care of the mental health of people. Not your organization, but in general, right? The global businesses, they have this bad rep. It's like work. We're not going to care about anything else. And people like yourself come in and actually, no, let's talk about this. You advise on ESG strategies and policies and priorities. So it's not, healthy longevity is not a personal or public health issue. It is a key business and policy priority. So what are some of the concrete policies that organizations can implement to enhance employee well-being and align with longevity goals? So examples could include corporate wellness programs, mental health initiatives, flexible work models, which a lot of people apparently are backing out of right now. The hybrid work model, a lot of people are reversing that, or regulatory advocacy. What's your viewpoint?
Thank you. And yeah, it's a really good point. It does get a bad rap that we are focusing really hard, whether it's in corporate, but there also, I think, is a growing recognition that when you invest in these ESG initiatives and when you invest in employee well-being, you do get those returns. And when you can align your business objectives with your social goals or a broader social purpose, you get the best of both. And you can prove both. When it comes to specific initiatives, I think you've touched on quite a few, and there are quite a few that organizations can adopt, and I think Organon does that actually quite well. There are some examples I'm happy to share, and it is around flexible working. One of the things we have is called an activity-based working model, so that employees have the flexibility to manage their own work and go to the physical office where that activity is required. So it relieves that burden a little bit of having to sit there in the office 9 to 5. And I know there's a big discussion about pulling that back, so I hope that doesn't happen, because I think we've proven that it can be done and we can be working in different places and still continue to deliver. And I know I'm seeing people nodding going, yes, yes, yes. So I'm hoping that does stay. The other thing that we have is called care leave. And it's designed so that you can take time to either care for yourself or someone in your life, whether that is physical or mental and emotional. And I've observed it being used in different ways. When we talk about the lens of women's health, I know that employees use that in the sense to get IVF treatments, fertility treatments, look after a family member that might be ill, and that's very culturally sensitive as well, but also in sort of different environmental crises, like where we've had earthquakes. I think we had one in Turkey, one in Morocco. We've had fires, we've had civil unrest around the region, so being able to have that flexibility to look after yourself. And the last thing that Organon does specifically is we have a company-wide shutdown every year on International Women's Day on the 8th of March. And the message is you need to prioritise your health. You need to address anything that you haven't been able to do at any other time throughout the year. And I think they're very simple things and they're very simple policy changes that can have a really, really big impact, and the industry can adopt that as well.
100%. Marwan, I'll go to you from an industry perspective, yeah.
Yeah, I just wanted to give an example of something that we've implemented in DSP with my team particularly, is that we rotate, we're working Friday from home between team members. So one member of the team can work from home, each Friday basically. Yeah.
Amazing. And are you going to increase that to 2 days?
Maybe, let's see.
Nergis wants 3. No. But when it comes to, I know, you facilitate public-private partnerships, right? So from the industry perspective, in terms of data sharing research and industry-wide best practices, do companies work together? Do you encourage companies to work together to maybe advise each other? I know you do bring resource in to advise on best practices on ESG and CSR, etc. Let's say to a startup or a company just about launching in Dubai, coming from abroad, what advice do you have for them? What's the first thing they should focus on when it comes to the ESG elements? What's your number one priority?
Advice for companies in general.
Yeah.
So in general, I would say, always start small.
Yeah.
Make sure that you have some sort of an agreement or a contract or, let's say, a validation of what you want to do, whether it's a service, a product, something new. And the nice thing is that, we are set up in a way that we can basically support their growth as they go. So they can start small, they can, grow with 5, 10, 20 people. And that, I think, by itself is ESG.
Yeah.
Right? So advice number one is localize what you're doing, your content, build relationships, network, never give up, always follow up and make sure that you do it at the right time. There has been many success stories.
And obviously facilitate connections through the DSP Leadership Network. Sorry,
Yes.
shameless plug. All right. So let's look at the future of holistic longevity, right? I'd love to hear one bold prediction or initiative, maybe from each of you, maybe not, but that you think will significantly shape the longevity landscape over the next few years. So Maria, for example, what role do you think will genetic testing and epigenetic therapies play in expanding preventative healthcare within the workplace? Is that going to become a thing where we're encouraging genetic screening?
Well, that's a very good question. So here's what I have to say. Well, we have such a great improvement and advancement in the technology of genetics, which causes the price of genetic testing to become more and more affordable. Therefore, the accessibility of genetic testing, counseling, is going to become very, very, closer to everyone's pocket. To your question, it's a very good point. So very soon we will be having genetic tests, so a whole genomic screening, just the way we do any blood test at the moment. That's going to not happen every year because, our genes don't really change every year, but we're going to have other additional tests such as epigenetic tests, updated information on our genomic screening. So just to break it down a little bit, when we say genetic tests, currently what happens is a whole genome sequence base. So there is a sequencing that looks in all the genes. However, the change is going to occur between now and, say, 5 years later within the knowledge and understanding what these genes are going to cause. What we know today is going to change 5 years later. Every day we learn more and more what each gene does. So that is something that people will use in the future by updating those reports with new information as the academic and scientific information are provided. And therefore you have an update on your genetics, and you have an update on epigenetics that's going to be more often undergone. You're going to have your pharmacogenomics, which is again helping so much with understanding which medication metabolizes better with your own body. So there's so many aspects of our genetic makeup that is going to be functional after all by each individual. So yes, to your question, I think employees or workplace should encourage employees to undergo such genetic screening, genetic testing, and then we can expand also onto the microbiome, for instance. And so all the other functional tests that are integrative with what our genetic and epigenetic functioning currently gives us as a health status. So I hope I did answer your question. And one more thing I wanted to add with regards to development as well. When we talk about epigenetics so much, and we talk about what we do today, how is this impacting later or future generation? And there is something called transgenerational epigenetic inheritance, which currently goes under research to understand if I am going to be living in a very cold place today and I'm having a child, how is this going to impact the child's resilience to stress, for instance? So there is so much research and data that we need to collect at the moment to kind of say, yes, what you actually did today is going to affect future generation epigenetically, not just genetically.
Oh, wow. So my actions are going to affect people. Oh, God, that's
I know,
another responsibility I didn't want.
I asked my son, would you still eat that burger today? He's like, yeah, why not? And like, well, I didn't do a good job here. But I mean, technically we have a lot of information to take of what we currently do, stress, food, nutrition. We will be passing on to the next generation. So on that note, we're actually open to put up a plan and hopefully raise grants for this study within DNA longevity in the coming year.
Wow. So, Dr. Tina, I'm now going to pass on all my issues apparently to next generations. I say this as if I have kids. I don't even have kids. I don't know what I'm worried about. But okay, so emerging mental health technologies then, how can that prevent somebody like me? Let's say I'm taking care of anyone and I don't want to pass on my issues to them. What technologies can we use to kind of start integrating into everyday life and preventative care? Now, I know wearables is a big one. Watches can show us if we're stressed, if we're not stressed, what our nutrition is like, if we're getting exercise. I love the pharma connection as well. You know, the one that I think we can all relate to because it's such a topic in the news, Ozempic, isn't it 30% don't react, their genetic makeup allows them not to benefit from it, yet doctors, nope, they just give you the Ozempic, that's it, but your screening will allow you to know whether it works for you or not. So in terms of mental health, what strategies can we start from now to prevent this generation?
Yeah, I mean, it's a huge topic, isn't it? The whole epigenetics and the transmission of trauma, and that's something that I've been fascinated by. I am of Indian descent, and, we talk about the trauma that is inherited and activated within us. So if you think about all the big issues that we're seeing currently in the world, across the world, and you look back in history, that actually those traumas are passed down 3 generations down. So my great-grandparents probably went through something traumatic, and I'm holding that within my body. So now it is up to me to take care of my mental well-being, to ensure that I don't pass on that to my children. And it's a huge part of our history and our legacy that we probably don't even think about. We don't often even look back to our histories. We don't look back to what our parents and our grandparents went through. And we have a responsibility to understand history and then to take control of what we do next. So we talk about breaking cycles. I talk about that all the time, breaking cycles. And what does that mean? It's number one, become aware of your history. aware of what your parents and your grandparents went through. If you know your history, you start to know and can take power of what your triggers are, of what the things that you're susceptible to. So might even be, physical health issues. And we know there's a huge link between, stress and diabetes and so forth and chronic health issues. We've got to start to take control. And I'm not saying that this is something that is fully in our control, but we have to start to become aware. So one of the things that I often, when my grandparents were alive, they would often say, well, it's in God's hands. And, that used to make me feel very sad, because actually that there is obviously things that are out of control, but we can now start to make a difference with technology, with wearables, with awareness and learning. And I use the concept of knowledge is power. The more that we learn, the more that we can then empower ourselves to make better decisions. So myself, as a parent, I want to equip my children with understanding what is mental health as a starting point. How can you regulate emotions better? How can I educate my children in being able to have, difficult conversations? It's these small things that we can do. And then with our own health as well, we can model to our children and our families around us that by doing a 15, 20, 30-minute walk after our dinners can actually help us with our digestion, can help us with metabolizing our food, but also from a psychological well-being perspective, that we're walking and talking and we're connecting. So there's so many little things that we can do from an individual perspective, but also this can be done from a society perspective and an organizational perspective as well. We have to all band together to start keeping this conversation going around our well-being, and it's a holistic piece. So if we use the technology and use it in a meaningful way, not as I'm wearing the latest band or the latest Apple Watch, look at me, I'm so trendy, actually using it and being critical as well, because the other end of the spectrum with digital technology is it can actually make us more anxious. I know that when I'm sometimes looking at my watch, I'm like, oh my gosh, I've only had 3 hours sleep. Oh my gosh. And then that makes me stay awake even longer. So again, it's about being really, really mindful of how technology is influencing us. And ultimately, we're in control. Don't let the technology control us. We are at the center of it. So making it human-centric.
Tell you what, my watch loves the steps that I do at Arab Health. Arab Health gives me like a whole month of like walking.
Just speaking of technology, I was talking to a friend who has a colleague, and we were just talking about mental health in general. So, and he was saying that he has a colleague who basically, when she goes back home from a long day of work, and they're investment bankers, so very stressful environment, and basically she dumps everything that she's gone through during her day to ChatGPT. And ChatGPT basically would converse with her, and not something she does, once or twice a week, but almost every day. And with time, the response of ChatGPT has been improving, because now ChatGPT knows all about the gossip that happens and all of the issues that happens in that particular work environment. So, and I thought, why not? I mean, if people are feeling comfortable doing that and are able to release some of their issues to a machine, it's better than siloing that and keeping that with them. For now, at least.
Oh my God, I could just imagine like 50 years time, there's going to be a panel about ChatGPT and how to fix its mental health because of all of our problems. Yeah.
I was just going to say,
trauma.
it's interesting, isn't it? Because ChatGPT is such a interactive tool, and I think that's what we really like about it. But the bit that I guess we have to be really, really mindful of is it better than a human connection? What are we trying to replace here?
It's better.
Oh.
It is better.
Controversial.
Wow.
No, it's better, absolutely better. Not better in a way that, supersede, but the data available for the ChatGPT data, it's not available for a human being. I'm a doctor, I'm a neurologist. I go to that to kind of, look what's in the background in certain field. The only disadvantage of ChatGPT, they are not updated enough. because they have to update their level of knowledge periodically, every 3 months, 6 months. So they are behind and they're really not updated. That's the big challenge for ChatGPT.
So there you go. That's the big challenge, right?
Yes.
But yeah, but look, it is valid, right? It is valid that we do have this technology at our hands, and sometimes, Marwan, it is just easier, just to vent to chat. Sometimes I don't want to tell someone something. Maybe I just want to say it to ChatGPT, right? But at the same time, yes, the human connection is really important, and this. I'm sorry that I'm plugging this again. The DSP Leadership Network. When we had that breakfast, when we had that soft launch, we did talk about how we just need that support. I see some people like Gigi, for example, we talk about how things are going, how we don't just talk about, okay, this is what we need to do in business. It's about talking about, okay, how are you feeling, how are you doing? And I encourage you all, honestly, I know this sounds so cliche, but genuinely, see how people are, check in with them, even on, at Arab Health, don't necessarily just, I know business is a priority, but still see what people are doing and see how you are, if you can offer support in any other way. Speaking of which, from the corporate accountability side, Sarah, and the ESG-driven health policies that are shaping the future of aging, because it does need to be priority, are we going to see companies taking on greater responsibility? What's the future looking like?
Look, I was just reflecting on what the panel was sharing, and I think we're getting more and more data and insights about healthcare conditions, about healthcare disparities. We're becoming more informed. So the only prediction is that we're going to be more targeted in the places that we invest our money and our resources and our time when it comes to ESG initiatives. And as we start to better understand the conditions that we need to focus on, the more that we're going to invest in them. And I'll go back to that first point about the report by the World Economic Forum. We now know clearly that there are 9 conditions that are affecting women's health lifespan and health span. So it's only logical that we will hopefully invest more and more in those spaces.
Well, I mean, hopefully, yes. So it's really, I think the key takeaway is the multifaceted approach. Genetics, ESG, mental health, policy basically will intersect and will define the future of healthy aging. So as we conclude, I just wanted to know any final notes from your side. If you had any advice to any businesses or any entrepreneurs here, what piece of advice would you give them in terms of taking care of their own, their own mental health, but their own taking ownership of their genetic screenings as well? Because it does scare some people sometimes. And also in the corporate side of things, ESG. So just one final note from you, ladies.
I would like to add one point.
May I just ask them to do the final point and then we'll go? Yeah, thank you. Okay. So Maria, what's your final point?
An advice. When it comes to, health, it's not necessarily genetics. It's a component. Genetics, it's part of the health of an individual. I always think we have to look at it as an ecosystem. We are not just the science or just the the organ or the mental health. We are an entire ecosystem, and we have to look at how do we function, how do we feel as an integrative way. Just to give an example, when we're analyzing, say, gut microbiome, and we have so many papers writing about the gut-brain axis, and it's so real because the moment you have migraine or you have a headache, try to think, what did I eat? Do I have something that is related to my digestion? That is something that we individually can develop regardless of the genetics, is pure instinct and knowledge as well. So the more you know about your body, the more you are aware how it should function, and the more you'll be able to pinpoint what could be the cause of an inconvenience and early have an intervention. That could be my general advice. When it comes to the genetics, yes, it does come with a sort of bias, right? Like, oh, I don't want to know, maybe it's bad news, or maybe, but I always say, like, better know than not know. Knowledge is power, to what you're saying. I also agree on that. Not knowing is just simply having no power to your own biology. And so now also it's very important to know there are so many technologies to early address these type of conditions, even they are genetic, if they are early detected with the early intervention, the results it's much higher and greater when we understand and detect it earlier than if we just wait, for instance, in our 30s, 40s, and we try to then, do some sort of intervention, but it's already kind of late. So do go for your genetic test, screening test, particularly that's what you're looking for. Carrier screening test if you're planning to have a family. I believe going back to the program that Abu Dhabi has implemented, it's extremely important for families to have the screening test so the couple will be fully aware what is the risk for their future children. So just a few examples of advice that I would give. Thank you.
Our first round of applause of the day.
I don't know how to follow that. I mean, look, mental health is going to be a constant key topic for all of us. We still don't know enough about it. We still haven't plunged enough money, time and effort and resource into understanding it, especially within this region. Localized is really, really important to understand culture, language, nuance, the differences between different communities. All of these pieces really, really matter. And I think that, we all have, like I said before, a responsibility and a role when it comes to our mental health. And it's not just about thinking about when things go wrong, when we're sick, when we're unwell, when we're suffering with anxiety or panic or, depression. It's also about the piece of how do we actually help people thrive. I love the framework of positive psychology. Again, a relatively new discipline within the space of psychology, gaining lots of traction within the US and across now the board as well. That actually there are key things, and again, they're very basic things. Gratitude, being grateful for everything that we have in front of us. It's about meaningful relationships. It's stuff that we've already addressed. These simple frameworks can allow us to become happier, healthier societies. And I think that, this region is already making strides way ahead of other countries in terms of this society as a whole. And we all have a role to play in it. And it is, like I said, not rocket science. It's small things that we can do to make the everyday a little bit better and easier for each one of us.
Fabulous. And another round of applause.
Both hard acts to follow. Look, from the corporate perspective, I think anyone questioning whether they should be running ESG initiatives or strategies, there should be no question about it. We can have initiatives that deliver social good and also have business and economic returns. It has been proven, it is necessary, and we shouldn't shy away from it. We should lean more into it and encourage more environmental, social, and governance initiatives that align with business objectives and actually have an impact on society as a whole.
Amazing. Thank you very much. Hey, 3 for 3. All right. So I believe we had a question. Sir, did that answer it, or do you have a question? Sorry, by the way, Marwan, because we're running a bit over, he had to apologize. He's got a delegation visit.
Thank you. It's not a question. As we well said, Gina, yeah, I just wanted to add and contribute to this discussion. So mental well-being, as soon as you are seeing every day more data, right? And everybody's are overwhelmed. So the situation can change, creating or having a digital carer with you. That's going to be an awesome change. And that digital carer will transform the sick care to preventive care. And the digital carer can definitely touch on the genomics and proteomics and metabolomics, all omics part as well. So this kind of leadership, country level or a state level or Emirates level, which we can take it as a next going forward strategy, that's going to be help all humanity and corporates. And we three are from this background. We work on the digital twin technology. Thank you so much.
Awesome, thank you. Do we have a question? Okay, so stand up, yes. All right. Any other questions? No, we're covered it all. Right. Ladies, it's been an absolute pleasure to have you. And he's saying no, he wants more, apparently. Oh, you have a question?
ESG in the age of Trump.
Right, so ladies and gentlemen, it was nice to see you today. And thank you so much for being part of our series of the DSP Leadership Network. So please join me in thanking Maria Antonela Axinte from DNA Longevity, Dr. Tina Mistry, who's a mental health expert, and Sarah Hariz, who is from Organon. So thank you so much. My name is Rachel McArthur. Do add us on LinkedIn. But ladies, before you go, I'd just like to ask you to stand for a group picture by the lovely Diana. Thank you.